During winter, we know there will be an increased demand for our services, with high numbers of patients coming to the emergency department with winter-related respiratory conditions and other illnesses exacerbated by the cold weather. Our priority this winter is to keep patients safe while supporting our colleagues. This means that it's more important than ever that we help our patients to get to the right place at the right time and then get home as soon as possible. We have already been doing a lot to improve flow through our hospitals by focusing on pre-12 p.m. discharges, discharging more patients at the weekend, using the discharge lounge as much as we can, and creating a dedicated acute frailty unit to take admissions straight from ED. To help keep our patients safe and ensure they get the care they need quickly during this winter period, we have put in place a number of extra measures. These include freeing up around 22 beds to provide extra capacity for medical patients so we can meet the increased demand we know is coming through ED. This includes using 10 beds in the Cambridge Movement Surgical Hub for patients who are medically fit for discharge. Based on current plans, this will not impact patients who are scheduled for surgery over that period. Converting a day room on Ward C6 into an additional bedded area for low acuity patients. Doubling our discharge lounge capacity by converting the boardroom into an additional discharge lounge with 16 chairs for medical patients. The current discharge lounge in Clinic 33 in the ATC will be used for surgical patients ready to go home. Creating a bedded discharge lounge in one of the medical wards for patients in beds. Increasing use of the virtual ward to enable more patients to go home sooner and to be monitored remotely. Speeding up the processing of patients by the complex discharge team for post-acute care. And finally, we are aiming to clean a bed area and turn it around for the next patient within 30 minutes, for those beds which don't need an amber or red clean. For our amber and red cleans, where enhanced cleaning is required, we use either ultraviolet or hydrogen peroxide vapor technology to disinfect rooms, and we are working to reduce the turnaround times where these technologies are used. Outside of the hospital, the integrated care system is providing further beds for those patients who are ready to leave hospital for another care setting. All of these actions will help to move people out of beds earlier in the day and free up those beds for people waiting in ED, enabling us to offload ambulances as quickly as we can. To help deliver these actions, we're setting up a winter flow command centre which will run every day. We know the winter months will be challenging, but together there are small things that we can all do which will make a big difference to our patients. Remember, if you discharge a patient 15 minutes earlier, that might feel like a small amount of time to you, but to the patient waiting at home for an ambulance, that makes a big difference. Thank you for everything you are doing to keep our patients safe.